Hello everyone, this is Mishka Kimball. I am so excited today because we're going to have a very special guest and her name is Prisma Martinez. I'm going to wait here for her to join us in a minute here and introduce her. And we're going to be talking today about help for new mamas and papas during this pandemic and after. And she's going to be talking to us about her expertise. She is a licensed marriage and family therapist and also a certified educator in infant massage. And she specializes in helping new parents with their new baby or soon to be parents. So let's have her join us. Let's see. Where is Prisma? I'm just waiting for her. And she should be connecting here very soon.
Hi!
Hi, Prisma. Welcome.
I made it!
Yay. Yes, you did. How are you?
I'm good. Thank you so much for having me today. I'm so
Absolutely.
excited.
Yes, thank you for being here. I was just introducing you a little bit and letting everyone know what you do and what you're all about, but I'll also let you introduce yourself and just tell us a little bit more about your expertise, your practice, what you specialize in.
Thank you. Thank you. So, my name for everyone to know is Prisma Martinez. I have my private practice. It is Prismatic Therapy. So, that's Prismatic with a Y. Prismatic Therapy. And I specialize in supporting moms and dads and caregivers. So, any mama, any papa out there who is expecting a new baby or just had a new baby, is trying to figure things out and just needs that extra support, some shine in their journey.
Yeah.
And so in addition to that, I also do infant massage. I'm a
Yeah.
certified educator in infant massage, so I connect infant massage to the services I provide, and that really helps with attachment and so many other great benefits that I'm sure we're going to talk about
Yes,
today.
and I love it. And yes, I'm so excited to talk about infant massage and what it's all about and the benefits for parents and baby, right? So,
Yes.
yes, we're definitely going to talk about that. And so we have 30 minutes here, so let's just jump right in. My first question for you is what are some of the challenges that new parents or, soon to be parents tend to face that you see in your work with clients?
Yeah, some of the common challenges, and it can be mom and dad or caregiver. We're including foster parents in there too. Some of the challenges that I tend to see a lot is one, not knowing what's coming, not knowing what to expect, what to do when it's time to go to the hospital and give birth or to bring the baby home. Once they have the baby at home, how do I get them to sleep, right? How do I sleep myself? How do I control this worry that I have or this sadness? Some disconnection from family, from friends, right? Their world has completely changed. It went from a strict routine, work, school, to now being at home with their baby.
A whole new
And
human
so,
being to welcome into your life, right?
yes, it's not only just them taking care of themselves, but now they're taking care of another little human being. And so sometimes another big challenge that I see is a disconnection between partners. Maybe mom feels like she's doing it all and she doesn't have any energy left, to do anything else. Or maybe dad is unsure, how do I help my partner? How do I help her with the baby? How do I help her when I see her sad or maybe, really worried, really anxious?
Yes.
So those are some of the challenges I tend to see the most, but every parent is different. Every baby is different. So with every experience comes a different challenge.
Yes, I can imagine. And so from what I'm hearing you say, there's a lot of different challenges. It could be emotional, physical, social, even, changes in like financial, right? Like things, because there's a lot of expenses too with the new baby. So there's a lot of different areas. And one area also that I wanted to focus on is the mental health. So, postpartum depression, for example, is something that can definitely happen, and it's a real thing, right? Can you talk to us a little bit about postpartum depression, what it is, and what are some of the symptoms?
So postpartum depression does not discriminate. Okay, it can happen to any mother and father. It can happen to fathers too. Doesn't matter what your age is, what your culture is, your gender, your socioeconomic status. It does not discriminate. And what I mean by that is, if an individual parent has some history of a mental illness or depression, or maybe someone in their family has also suffered from a mental illness, they are at times more prone to experience it as well, right? If they are still struggling with something themselves, they can. And so what postpartum depression looks like, sometimes individuals may feel like, wow, it's this overwhelming anxiety, or it's this overwhelming sadness.
Yeah.
But there's other things in there too. Hopelessness, feeling like, anything that you do just isn't right.
Yeah.
Sometimes, feeling like I've lost motivation. I've lost motivation to do anything. I look at my baby, I'm caring for my baby, but there's no connection. Some of that postpartum depression symptoms also can be difficulty concentrating, difficulty making decisions, these self-doubts, some scary thoughts as well, thinking something's going to happen to my baby, or am I going to do something to my baby?
Right.
So postpartum depression can look very different. Yes, there's specific symptoms, but at the same time, every parent experiences them differently. Right?
Yeah.
Experience is unique.
Yes, and I think that's really important, that it's all very different. Like you said earlier, every baby's different, parents are different. And I even think culturally, right, how we experience everything is different and can be unique. And I really like what you explained, that it does not discriminate, and it can happen to the mom and the dad, because we think that it's only something that happens to mothers.
No. Yeah. And so for dads, sometimes we might see a little bit of different symptoms. And not all dads, not all males experience this, but some males, when they are experiencing postpartum depression, right, there's that sadness, hopelessness, maybe overwhelming anxiety, but there is also different behaviors that we might see. They might seek substance use, or they might seek more aggressive behaviors, or they might be more absent. Right? Not that they don't want to be present in the home, but because it's so overwhelming to see their loved one hurting and feel so helpless, then, they are affected themselves. So it can happen to both. And there is research that proves that caregivers and foster parents can experience it too.
Wow.
They can. And so it does not discriminate.
Yeah.
It can happen. But there is hope.
Yes, tell us about that. How can it be treated? Because it is treatable. So how can parents get help?
How can parents get help? So they can go to www.prismatictherapy.com and speak to me, give me a call. But in reality, in therapy, when you choose to seek out support, right? When you choose to call someone and say, hey, I don't feel like myself. I don't feel the same as before when, I didn't have this baby, or before I got pregnant. And so in therapy, the beauty of it is that it's individualized to the person's needs. So because, right, your experience is different, your therapy will be somewhat different than another person who's come to therapy for postpartum depression, right? There are some skills that we tend to provide to every client, which is coping skills.
Yeah.
Mothers and fathers can totally benefit from coping skills. And what I mean by that is just mindful techniques, meditation, deep breathing, learning to sit with your emotions, learning to name what's happening, your thoughts,
Yeah.
right? Learning to find ways to be able to release that anxiety or that deep sadness.
Yeah.
So it could include learning how to journal, learning how to, set routines, set boundaries,
So
boundaries
important.
with,
Yes. Mm-hmm.
yes,
Mm-hmm.
because sometimes, depending on our culture, we might have some cultural myths that maybe, our elders want us to follow.
Yeah.
And so sometimes I hear moms and dads having such a hard time breaking away from that.
True.
But I want to raise my babies differently. I don't want to raise them, as so and so did. And when there is that battle, there can be that disconnection. When there is that disconnection, there can be some loneliness.
Yeah.
And so we talk about all that stuff, in therapy. We talk about those scary thoughts that come up, right? Those thoughts of, will I hurt my baby? Is my baby safe with me? Or maybe I'm not feeling safe myself.
Yeah,
Right?
and I think with that, they can also maybe experience a lot of guilt, right, about feeling that way. Yeah.
Yes, a lot of guilt. So therapy can look, very different. It's very tailored to your needs and what, you feel is important for you. And together, we work towards healing. We work towards finding solutions that really help you in your day to day.
I love that. Yes, and just the beauty of being able to have therapy and the having that healing space, right? And I know that postpartum can also be treated at times, with medication, right? Like that could be part of the treatment. Mm-hmm.
Yes. Yeah, parents can always go also to their primary care provider and talk to them about what's happening. Hopefully all primary care providers out there and OBGYNs are doing screenings to
Yeah.
help parents
Yeah.
that support. There is also international directories where you can find therapists close to you that specialize in perinatal mental health. That's a big term that we use.
Mm-hmm.
Maternal mental health,
Yeah.
or just support for parents.
Mm-hmm.
There's a few that I like to mention because they're great resources. There's maternalmentalhealthnow.org and there's postpartum.net. They have great directories and they have information, research. Postpartum.net also has free support groups for moms.
Wow.
And yes, especially during this
Even
time.
now during the pandemic. Mm-hmm.
Yes,
And
it's
is
so
it
much.
done virtually? Are there groups that are being done virtually?
Yes, all of the groups are virtually and they're free for any mom to connect and just find that support. So those are really important resources that every parent should have.
Thank you for
And
sharing
I'm glad we're
those.
able
Yes.
to share them.
And I know that there's
Yeah.
something else that can also help parents, right? It can also help with postpartum and some of the other challenges that we were saying in the beginning that new parents face. So that's infant massage, and that's what one of your specialties, right? So tell us about infant massage. What is that?
So infant massage is this beautiful art of nurturing touch. And what that includes, every infant massage stroke includes Indian and Swedish massages. It includes yoga movements and it includes reflexology.
Wow.
And so together we combine all of those things to have specific massages, specific strokes that one help babies' full body. Everything from their head, their back, their arms, hands, feet, legs, their tummy. So it really takes care of baby completely from head to toe. But also in there, along with baby benefiting from infant massage, the parent, the caregiver benefits from infant massage. So as you're massaging the baby, right, baby and you are releasing oxytocin, which is the love hormone, right?
Okay.
So that helps with postpartum depression. There is research that says that infant massage really helps during the postpartum period, because as you are massaging the baby's smiling, giving you signals that there's connection, that there's eye contact, that there's love there.
Yeah.
And so imagine if it makes us smile, right? If it makes
I know. I'm
warm.
like thinking about it, and it's making me smile.
Yeah, so for a parent, you know, that is just the special moment, the special time, just you and your baby, nothing else, you know, going on around.
I love it. I love it. You know, and we have some people here giving us some cards and some love. Thank you. Prisma dropping diamonds. Yes, she is. And thank you, Melanie, for your comments as well. So important to mention fathers. Thank you for the work you do. Thank you, ladies, for joining us. We do have a question, and what I'll do is I'll just leave the questions for the end, and we will take the time to answer some of your questions. So Prisma, I think you have some baby dolls, right, that you can show us? Yes. And
I want to
maybe like demonstrate a little bit of how you do infant massage. Yes, so look at that.
This is one of my babies. I have 3 babies, and they're each from a different cultural background.
I love it.
And so the reason for that is when I'm in class with mom and baby, or dad and baby, right? The baby will look around and will want to see, right, his or her surroundings. And so how beautiful is it to look to the side and see a baby, their skin color, right?
Yes.
So I have different ones. This one has been with me, I want to say, since 5-6 years already.
Wow.
And so in infant massage, I use my doll. I do not touch baby. I do not give massages to your baby. You do all the massages with the baby. I will teach you with my doll, and you know, if there's 2 parents, and they will take turns.
Okay.
They will take, then one parent will maybe do one arm, and then the other parent will do the other arm. Or sometimes mom will do the arms and dad will do the legs. One specific infant massage technique that parents really look forward to is how to release gas.
Okay.
So I have many different massages for the belly. Let me see. Can you see my whole doll?
Yes.
One of the big ones, right? We would lift their legs up, you know, down, up and down. So that's something very simple that any parent can do. Right? Any parent can do it at home. But one thing I want you to keep in mind is whenever you do that, you want to keep eyes on your baby. You want to read your baby's cues. If your baby's smiling, right? If your baby's hands are opened, right? And looking around or looking at you, they're engaged. If your baby's looking away and there's no smile, then the baby's no longer engaged. Yeah. So that's super important. Another big tip I give parents, whenever you start infant massage, we need to ask for permission.
Oh, permission to the baby?
Yes.
Oh.
Permission to the baby. So what that would look like is, say I have, you know, my baby's laying down on the floor. You always want to make sure your baby's safe. So you can put a blanket, a mat, you know, something to make sure the baby's safe. And you would do this kind of movement with your hands. So I'm going to put my baby down for a second so I can show you.
Okay.
You would do this kind of movement in front of their eyes, right? So say my baby, say you're my baby. I'm going to give it to you, Mishka.
Okay.
So, and say, hi, Mishka. It's so nice to be able to give you a massage today. Do you see my hands? Mishka, is it okay if I give you a massage today? And so the baby will more than likely either smile or, I don't know, giggle or move, you know, their body. And so that's your cue.
Yeah.
Yes, that the baby is ready to engage. The baby's ready to connect. And if, say, the baby turns away and they're not ready at that moment, then that's okay. You know, you try again, you show them your hands, or you can do a resting hands, which would mean you would just put your hands on them, right? Kind of play with their hands, with their feet, anything to get them engaged.
That's so beautiful. And I am just thinking about how this can improve and just make the connection and the bond between the baby and the parents or the caregivers just so much stronger, right? And how that can help with attachment, which, you know, that bond that we have as babies is so crucial for just the rest of our lives and how we relate, right, to people and the attachment style we develop, and to really be able to have that connection and feel safe and feel secure with the parent. I can see how many benefits this, you know, doing infant massage could have.
You're teaching your baby language, right? As you're massaging them, you can tell them, this is your arm, this is your hand, right? You know, this is your face. If we're doing massages on the face, one really good one that parents love is for teething. So when babies start teething and they're having a lot of aches, you know, and pains in the jaw, we do circles. We do circles on the top, and then we do circles bottom, and that helps their jaw, but that also helps their gums feel relaxed.
Oh, I bet they love it. Yes.
Imagine moments where your baby's crying and you have no idea what's wrong. You have no idea what's happening. That mommy guilt, that mommy pain, that mommy sadness, like, I'm not a good mother. I'm not doing it right. Right? Learning these infant massage strokes, you know, these different techniques can help you feel confident, can help you feel like, hey, I got all these tools in my bag and I can bring them out and use them. And some of the massages are really to stimulate baby, to wake baby up. And some of them are to help baby relax. So it helps with the deeper sleep. And so imagine your baby being able to sleep longer. Mom can sleep longer. Dad can sleep longer. Or break.
And that's huge. That is huge. Yes. And so important for mom to be able, and dad to be able to sleep. So Prisma, you know, in the interest of time, so let me ask you about your classes. I know you are doing, during, you know, this pandemic right now, you are offering virtual infant massage classes, right? Tell us about that.
So it's 5 classes total. So they go 1 per week. And the reason for that is, say today we meet for our first class, you get to learn a few massages, and then you get a week to practice them and feel them out, right? Test them. See how your baby responds. And then the next time we meet, it gives us a chance to answer any questions, maybe adjust the technique to your baby's needs, and then you get to learn more massages. And so it's a 5-week course. I provide individual classes and I provide group as well. I'm starting a group this Monday, but every week I'm able to start a group if moms and dads are interested. You know, if you contact me and you let me know, hey, I couldn't make, you know, this group, is there going to be another group next week? Let me know and we can start that, or we can do one-on-one. And when we do one-on-one, I welcome you to invite your partner.
Okay, great.
You know, it can be either, you know, right, your husband, your wife, a partner, a caregiver who cares for your baby. So maybe your mom, your dad, anyone that is.
Yes. Awesome. I love it. And also you offer them in multiple languages, right?
Spanish and English. En español.
En español, sí.
Toda la información en español, lista para usted.
Muy bien. Yes, I love it. So English and Spanish, and they're virtual, so you can still do it safely, and you don't have to wait until, you know, who knows when we'll be able to return to the office, right? It could be done right now. So Prisma, if anybody wants to reach you, how can they find you? And, Instagram or website, like give us your contact information.
So for Instagram and Facebook, my handle is Prismatic Therapy. So that's Prismatic and then therapy. And my website is also www.prismatictherapy.com. If you are looking specifically for infant massage and parenting, then that's Prismatic Parenting. So there's a difference. Prismatic Therapy is for parents who are needing support with postpartum, maybe they just got pregnant and they're trying to find mental health services, right? And Prismatic Parenting is more for the infant massage, the parent coaching, just wellness overall.
Yes.
So Prismatic Therapy and Prismatic Parenting.
Yes. And so Prismatic Parenting, that's also, there's a website, it's prismaticparenting.com, and Instagram, Prismatic Parenting. Yes. Awesome. Thank you, Prisma. So we're going to answer some questions here. And if anybody has questions right now, go ahead and put them in the comments and Prisma can answer them. All right. So let me go through here. Let's see. Where's that question? Up to what age can parents practice this with their kiddos? I'm guessing infant massage. Yeah.
Yeah, so that's a great question. So it's always best to learn it when they're babies, right? Nurturing touch is so important. That skin to skin, that contact is so important as an infant. So we always suggest about 6 weeks after birth. Because they're babies are still adjusting their intestines, right? Their digestive system, getting used to being outside of the wound. So we want to start at 6 weeks after delivery, and it's really good up to a year, so 12 months. Why? Because by 12 months, babies are moving and they're starting to walk and they want to crawl or they want to go play. But the beauty of it is you can use it for the rest of their life. You can use it as a toddler, as a preschooler, school age, teenager. I'm sure there's some massages they would still enjoy as adults. And when I did my training with Infant Massage USA, they shared with us that these massages are also helpful for the elderly.
Oh my gosh, yes. Absolutely. I hadn't even thought about that.
So it also helps them relax, helps them stimulate, because these massages are so specific to parts of their body that, if you learn how to do specific foot massages, of course, that could definitely help your mom, your dad, your grandma, your grandpa. But of course, the best time to learn them is when the child is an infant. And as you teach that child, then as they grow, you keep using them. We do not teach infant massage to, older children or adults or grandparents. It just means that if they start as a child with infant massage, then they continue.
Got it. Thank you, Prisma. So we have other comments here. Gloria said, so sweet. Thank you, Gloria.
Thank you, Gloria.
Thanks. This was great. Thank you. Lots of great information. Thank you, ladies. Thank you all for joining. Amazing way to model for parents. We got lots of beautiful comments here. Thank you so much to all of you. I have another question here for you from Melanie. What sparked your interest in working with those with PPD, postpartum?
That's a great question, and I'm going to be very transparent with you all, very honest. Growing up, I witnessed many of my family members, my own mother, suffered through depression and anxiety. I know what it is to be that sibling, to see that distance, right? That disconnection, to not be able to pick up on those cues, family, friends that have experienced it and they're so close to me, and so growing up, in my mind, I always thought there has to be a way to help parents You know, maybe they didn't have that nurturing touch from their parents,
Yeah.
but they can learn it themselves, right? Or maybe they suffered through depression, anxiety, PTSD, you know, different mood disorders, and they didn't know who to find for help. They didn't know who to reach out, or they were told therapy is for crazy people, right?
Yeah.
And in my cultura, that's what it is.
I know.
If
Yeah.
you therapy, that means there's something wrong with you. But really, no, it takes so much strength to be able to say, I need help, you know. And so that's really what sparked my interest. And that's me just being real.
Yes. Thank you.
A little bit about about me, but it is dear to my heart. And so throughout my education and, you know, every job I've had, it's been part of my passion to really help build those connections, to promote nurturing touch, compassion, curiosity.
Yes.
You know.
Well, thank you for the beautiful work that you do, for sharing with us your expertise and also your personal story and being vulnerable with us and so real. I love it, Prisma. And you know, you shared so many amazing things with us today. So thank you for joining us, and thank you everyone for being here.
Yes. Thank you, everyone. I love your hearts, your comments. I appreciate you. Sending you love and kisses.
Thank you. And if anybody wants to reach Prisma, you know, and if you came in late and you missed it, you know, she is certified in infant massage. She's also a licensed marriage and family therapist, and she is offering parenting classes for infant massage classes, right, virtually. You can reach her at Prismatic Therapy. My Spanish accent just came out. Prismatic Therapy and Prismatic Parenting. Those are her handles on Instagram and her website. So there you go. Thank you, Prisma, again, and thank you, everybody.
Thank you, everyone.
All right.
Hope to see you again. Thank you, Mishka.
Bye-bye.